one of the things that we're very aware of is that we were spending a huge amount of time managing just day-to-day performance and looking at ways in which we could reduce the time that our managers and clinicians spent was going to be fundamental. So working through, in this case it was with Alamac, how we managed our numbers, how we understood our numbers, and how we used the numbers of patients coming into hospital or discharges to actually predict what we needed to do in the future. So getting ourselves into a position as an organisation and supporting people to have that data on a regular basis and to use that data relentlessly to predict the future. So, you know, were we looking through the front windscreen, or were we constantly looking through the back windscreen and saying, are we looking at failed performance and trying to understand why? So that's very much what we've really tried to do over the last couple of years. What was interesting is when we started to really get into individual sort of directorates and clinical team numbers. Did they know their numbers? The answer was sometimes no. And then the next question was, did they know what to do with those numbers, and did they know how to use them? And what became quite apparent is we hadn't got people who were very familiar and confident. So actually some of the training and technical support that we gave those teams has been really important. And the other area is around, it's tough times at the moment, and developing leadership skills so that people have got enough in their bag to deal with some of those difficult situations when they're trying to encourage either individuals or teams to do something different. So we set up a whole organisation Leadership Matters programme and put all our clinical directors, our clinical service leads, our directorate managers, all going through that programme, which provided them with some safe opportunity and time to talk about the things that they found challenging. And actually what we have seen as a result of that is many of those groups that have gone through those leadership programs still meet together. They might not be from the same clinical team, but actually they're almost developing their own action learning sets, which is brilliant within the organisation. What we've done, particularly, and a lot of emphasis that we've put is around managing performance, and managing performance as a whole hospital. So looking at the quality targets, looking at the performance targets, looking at the finance targets, looking at the workforce targets, pulling all of those together and focusing on those as a whole has been important. Then being able to take individual areas and develop our own stretch targets. So if I give an example, one of the areas that we hadn't had a good track record at is the consistency in infection control. We'd had some very good periods and then we'd have some poor periods, and actually by relentlessly focusing on a stretch target, we've been able to drive right down those numbers of patients that get hospital-acquired infections. So really big benefit for patients, and it's one of the things that causes patients so much anxiety if they think they're going to come into hospital and get an infection. But from an efficiency perspective, they stay less time with us if they don't have an infection. So therefore overall productivity of the hospital goes up as well. So there's win-win for everybody. There are a number of local organisations that we are currently working with, and one in particular that we've had some discussions over the last year, identifying areas where we think if we work more closely together we can integrate our services, we can reduce some of the cost of those services, but we can also clinically sustain them better. So things like maybe sharing 24-hour rotas. So if we both have got a 24-hour rota, do we both need to? If we actually had them on, rotating weeks on different sites for some specialties, we've not reduced access for patients that much, but actually we've increased the capacity of those teams in the daytime to treat more patients through elective lists and emergency lists. So those are the type of discussions that we've been having and identifying where that will work, and also looking at more formal pieces of work to look right across the whole spectrum of what we do, around where there may be some sort of benefits for both our patients, but also for the overall sort of reducing the costs of the services.